Good morning, everyone. I am Valsama Abraham, President of Indian Nurses Association of South Florida. Likes to welcome Dr. Walda Serafin and Dr. Bobby Varghese, and welcome each and everyone who joined this webinar. On behalf of INASF, I like to congratulate each of you for being in the healthcare profession. Healthcare workers face a high risk of workplace violence, with the studies showing that a significant percentage experience some form of violence, including physical and verbal abuse. In 2024, a nationwide survey conducted by National Nurses United found that 81.6% of nurses have experienced at least one type of workplace violence, and nearly half have seen a rise in rate of violence. Over the past 12 months, especially after COVID, we've been witnessing a steady increase in workplace violence, mainly to the healthcare professionals, especially the nurses working in the inpatient hospital units, has the highest prevalence of 93%, and outpatient hospital settings within 91% at any time in their career. Workplace violence in healthcare can range from verbal abuse and threats to physical assault and sexual harassment. Physical violence, including being pushed, kicked, or struck, is also a serious concern. Now, I would like to unfold the reason for being urged to come up with this topic, which is very relevant to the current time. As everyone is aware, recently one of our beloved colleagues was brutally attacked by a Baker-acted patient and was severely injured. First of all, on behalf of INASF and NANA and the entire healthcare team gathered here today, wish her a speedy recovery and offer our prayers and support to the family who is tirelessly working towards bringing her back to the normal health. It is an urgent need that we need to address this and provide some awareness to the healthcare professionals as well as to the public, even though it is not preventable sometimes. I wanted to introduce myself first. I've been a nurse for 35 years, and currently I am an associate professor in Broad College. Most of my experience in the hospital settings, worked in like ICUs and different units, witnessed many cases of violent attacks, and I experienced few of them, and of course luckily got escaped from that. I would like to, without any further ado, I would like to invite Phoebe Thomas, our Education and Professional Development Chair, to introduce Dr. Borda Serafin now. Phoebe, you are welcome.
Morning, everyone. Thank you. My name is Phoebe Thomas. It's my pleasure to introduce the speaker for today's webinar, Dr. Warda Laura Serafin. Dr. Serafin holds a doctorate in nursing practice and is a dual certified family and psychiatric nurse practitioner. Currently, she works as a nurse practitioner providing services for veterans. She holds an academic appointment at Miami-Dade College of Nursing as an associate professor. She previously held positions as a clinical staff member and educator at Miami Veterans Medical Center for 8 years. During her employment at Miami VA Medical Center, she was instrumental in developing evidence-based projects and research-related activities focusing on veteran-centric needs. She is a National League for Nursing NLN member and Sigma Theta Tau International Honor Society of Nursing. Dr. Serafin also presented on veteran population at the Sigma Theta International Conference. Dr. Serafin plans to expand her research on the veterans in transition and reintegration into the civilian sector post military service. Please join with me in welcoming Dr. Varda Laura Serafin as she shares her expertise with us today. Welcome, Dr. Serafin.
All right, thank you. Thank you for the wonderful introduction. All right, so good morning, everyone. I'm going to go ahead and share my presentation. Okay, so hopefully everyone can see my screen. All right, so today I'm going to talk about the types of violence in healthcare because it is a significant problem, not only in mental health facilities, but we're experiencing this type of violence in different settings in healthcare and how to recognize the signs and abuse in patients. So I would like to first, talk about the overview of violence in healthcare. When we look at, traditional press or the news, we usually think that, violence we usually imagine violence as gun violence or something homicidal in healthcare. However, we have to understand there's different types of violence in healthcare, not just physical, but verbal, intimidation, assault, when patients start stalking you, or even sexual harassment. And that's very often experienced in healthcare. So usually perpetrators of workplace violence can vary, but violence usually occur with staff and co-workers too, or you could experience with your supervisors, co-workers, all types of staff and so forth. And nowadays, especially when you work in mental health, not only you're getting violence towards patients, but we're getting it from family members, we're getting from visitors and healthcare staff because, we work in a very stressful environment. And we're going to talk about, patients, especially with the drug problem now, because, substance use makes patients more aggressive. And also, we have horizontal violence that occurs between coworkers, bullying, job-related bullying, and intimidation. So, whenever these things happen, that really affects the healthcare workers' morale, and they get a lot of fatigue, and they can end up getting depressed and so forth. So it's getting very rough now with all the violence we're experiencing in healthcare. So, for example, we experience a lot of violence in emergency room departments, psychiatric units, but anywhere in healthcare. Because I recently had a colleague of mine who works in a step down unit. She's a registered nurse, and one of the patients, choked her on the floor. And thank God, another nurse saw and she rescued her. And she said if the other nurse did not walk in, she could have died from suffocating. So that did not happen in the ER or the psych unit, that happened in the step down unit. So, as healthcare providers, we really have to be very mindful of our environment because, now violence has really become a significant issue. So there's different type of workplace violence that I wanted to touch upon. We're going to talk about criminal intent, worker on worker, customer and client, and personal relationship. So I wanted to start off with criminal intent. So this type of violence, the perpetrator has no affiliation with the hospital or healthcare facility. So let's say a nurse, she's done with her 12-hour shift and she's ready to go home and she, ready to go to her car. And all of a sudden, she gets robbed or, the person trespass and does something violent towards the nurse, then that nurse can experience that type of violence from that person. This doesn't happen very often, but it's important that when you do go home from work, you definitely have to be very mindful. Also, I have a colleague of mine. She's a psych nurse practitioner. She owns her private practice in Palm Beach area, and one of her patients actually waited for her when she closed clinic and the patient wanted to have sexual relations with her. She was so afraid. So when she told the patient to go, he wouldn't go. So she had to call the police. The police had to get involved to have the man, you know, re, actually get out front of the door because she was afraid that he was going to sexually harass her. So customer and client. So this one's the very common type of violence we're seeing now in healthcare. So this is when the client, the nurse, or any healthcare provider gets attacked from the patient. So research shows this type of violence occur most frequently in the emergency room, in the psychiatric unit, waiting room, in the geriatric setting. But like I mentioned, it can happen anywhere. And nowadays, I work a lot in mental health. And now I usually tell my students that, it's not just a mental health problem. Now, a lot of mental health patients are taking more drugs. And, most of these drugs make you more psychotic, like cocaine, for example, or mollies or alcohol. And whenever patients consume a lot of these drugs, it just impairs their judgment and it makes them more violent towards people. So that's why a lot of nurses and other healthcare providers are being attacked in the healthcare setting because there's not just the mental health issue, there's a drug problem too. So, worker on worker, this is very common too. So, that could be lateral or horizontal. So, that could be from bullying or, verbal or emotional abuse. And, when, people are just unfair, staff members are unfair towards others, or your supervisors being very unfair, or they're humiliating you. And this really can affect someone's morale, and that could potentially make somebody violent too. So, it's important that, as healthcare providers, that we, respect each other, and services are offered to nurses and other healthcare providers, to be respectful towards one to each other. Now, personal relationship. Now, the perpetrator has a relationship to the nurse outside work, but they come to the job and, start arguing and, start threatening the nurse or the other healthcare member. I remember when I used to work at the VA, there was a nurse who had issues with her husband, and the husband came into the workplace and threatened to kill her. And thank God, it was settled, because imagine he did bring a gun or weapon. Others, nurses or other healthcare providers could have got hurt because of their personal relationship at home. So that can happen where, the perpetrator has a relationship with the healthcare provider and try to resolve their issues in the workplace environment. And that put other people at risk of getting hurt. So there's a new type of violence that we're seeing now that is emerging in healthcare. Is ideological violence. So now, a lot of people have a lot of, beliefs and a lot of ideology. And when people do not, agree with their beliefs or ideology, they can become violent, difference in political views and so forth. So it's important that healthcare providers, we remain neutral in the healthcare setting, because, if there's any conflict, then, definitely people can become aggressive because, people differ from their beliefs. So other forms of violence. So we definitely see this a lot in the healthcare setting. So, sexual harassment that can affect both patients and staff. So it's important to be mindful about that. Cyberbullying has becoming a growing concern, and healthcare providers are being humiliated by patients or even other staff members, through Facebook or TikTok, Instagram, and people recording videos while they're in the healthcare facilities. So they're violating HIPAA. So all that could be very challenging. And of course, racial discrimination too can manifest as a form of workplace violence as well. So signs of abuse and violence. So it's important as healthcare providers that we know what are the signs when people are starting to become violent. So I usually tell students that, when you ever have a patient or even a staff member, but primarily patients, when they're walking back and forth, they're pacing, or, they're clenching their fist, that are all signs of aggression, or their voice start getting louder or even too low. Sometimes if they're talking too low, that too can be a sign of impending violence. So it's important that you pay attention to people's body language, but sometimes it's not always verbal. Always look for signs of alcohol and drug abuse. If they're intoxicated, or their judgment is very impaired, they're very impulsive. All these are signs that they can become abusive. Of course, when patients start making inappropriate gestures, like, they're making gun signs, or they're telling you they like to shoot or like to hunt, or they like to, do things that are very risky, that likes to hurt people. These are all signs that, they can become abusive. So again, you need to, be very mindful when patients tell you that they want to hurt someone, or they're being very intimidating, belligerent, harassing, bullying, or very aggressive behaviors are all signs of abuse. And remember, it's not only from patients; it could be from staff members too. So all these signs you got to be careful of, because and I always tell my students too to always keep a distance between you and the patient, because sometimes you don't know what they're going to do, because working in healthcare is very unpredictable. So it's important to be mindful about boundaries and look at for these signs of aggression, so they don't start doing something inappropriate, because sometimes depending how they hit you or compromise you, it's hard to escape. Um, Again, it's just being very mindful in mental health, being mindful in any healthcare facility, because now, people are becoming very, very aggressive. And from my clinical experience, I noticed a lot of people are getting very aggressive, based on stressors in life. Life is getting more stressful, and there's a huge drug problem. So we all know when people take drugs and substances, that really impairs your judgment, and people become very impulsive, that way. All right. Thank you. Any questions?
Thank you. Thank you, Dr. Varda, for all the valuable information you brought to us. Very inspirational, very helpful, and I'm sure we'll be implementing a lot of it, because it's like a eye-opening for us, like a lot of warning signs we see. But sometimes what happens is we ignore it, thinking that it's our patient, maybe, that is mainly the problem. Okay,
Yeah.
thank you so much, Dr. Varda. Very
No problem. No
interesting.
problem.
All right, now the next speaker is Dr. Bobby Burgess. Dr. Bobby Burgess is a full-time professor of nursing at Broad College and psychiatric nurse practitioner in Florida. He is dual certified as a psychiatric mental health nurse practitioner by the American Nurses Credentialing Center, which is NCC, and as a certified nurse educator by the National League for Nursing. Dr. Varghese completed his Bachelor of Science in Nursing at Mahatma Gandhi University in Kerala, India. He later earned his master's degree in psychiatric mental health nursing from the National Institute of Mental Health and Neurosciences, which is NIMHANS, in Bangalore. In recognition of his academic excellence, he was awarded the prestigious Gold Medal by late His Excellency Dr. APJ Abdul Kalam, the former President of India, for graduating with the first rank from NIMHANS in 2004. After relocating to the United States, Dr. Varghese earned his PhD in nursing and completed his postgraduate certification as a psychiatric mental health nurse practitioner. Throughout his career, he has contributed significantly to his professional community, having served in various leadership roles within the organization, including president in 2019-2020 term and vice president of the National Association of Indian Nurses of America, which is NINA, in 2021. Let's put our hands together and welcome Dr. Bobby Varghese to this wonderful presentation. Dr. Bobby Varghese, welcome.
Thank you, Mrs. Walsama Abraham, for giving me the opportunity. And thank you, Dr. Varda Serafin, for that wonderful introductory speech on violence and the science of violence. I think I need to be very careful not to be redundant or to reiterate things that she said, Dr. Varda said, Serafin said, but I'll be focusing more on certain things that are not said. So let's go with the statement. It's a statement that American Nurse Association take it very personally to themselves. It is never okay to get abused or to get assaulted. It is never okay. Let's make it a slogan. So we need to openly denounce violence and make it clear that any form of aggression will never be tolerated. And we deserve better. Why do I say this? It's all based on statistics. And one of the statistics that I recently saw by the National Nurses Union is that 81.6% of nurses are assaulted every year, 81.6% of nurses. One of the previous studies 3 years back by the American Nurse Association 2022 says that 25%, that's 1 in every 4 nurses, are physically assaulted. It's not emotional, it's not assaulting your morale, it's assaulting your body. 25% of nurses. That's a big number. One of the most recent studies by a law enforcement agency says that the abuse in law enforcement is very low comparing to abuse in healthcare workers or among healthcare workers, where healthcare workers account to be up to a 95%, which is a very high number. It's not just nurses, but healthcare workers as a whole. 95% of them are abused either physically or verbally. So that's a big number. So whenever we speak about prevention or mitigation of violence, we hear many, many stories for hours on safe culture, just culture of safety, mitigating strategies, and all those kind of things. When we listen to those kind of seminars and webinars kind of thing, it goes through one of our ears and exit through the other ear. I don't know how much we capture, how much we dwell on, or I'm not sure about that. So I thought, let me make it into a very short, small strategy that we can take it home or take it away with us so that we can at least try to remember it every day in our life, because we are healthcare workers. We meet patients at least 4 to 5 days a week. We are with patients. So I just made an acronym A, B, C, D, E. Easy for remembering. A, B, C, D, the alphabet A, B, C, D, E. So let's go with A. A stands for awareness, anticipation, and assessment. So I repeat, awareness, anticipation, and assessment, 3 A's. So what is awareness? What does that mean? In the context of acute care, because our topic is on shielding ourselves in acute care environment, so situational awareness is a very important thing, to know what's happening around us. It's not to know, but to be mindful. That's a big word, mindfulness, a very emerging uh, concept in psychology and everywhere else too. Being mindful at all times. We need to know what situation is at hand or are we currently in. That includes our patients, the environment, the floor, the unit, the lighting, the condition of the patient, the previous or past behaviors of the patient, because without anticipating danger, if we put ourselves in any such kind of situation, it'll be partly a lack of judgment from our part. I don't say it fully because sometimes we engage in certain situations in patient care that we need to go help them save life. So it's not 100% scenario situation that we can protect ourselves, but partly we need to be aware about where we are and what's around us. Lack of anticipation of danger is a lack of clinical judgment. We always talk about clinical judgment, so we need to be that torchbearers of clinical judgment. The third one is assessment. I think Dr. Serafin touched on assessment, what to assess and when to assess. Assessment is a big part of mitigation, assessing our patient, assessing the condition that they go through, assessing whether they are addicted to alcohol, drugs, or so, assessing how many days it is that they are without alcohol, because we know what is alcohol withdrawal, we know what's drug withdrawal, opioid withdrawal, we know what is delirium tremens, like in 2 days when they are in hospital, maybe the third day they will start with delirium tremens, so they can start hallucinating, they can see things that are not there, they can see nurses as animals, or they can see a syringe as a knife or a gun. So we need to know exactly that these are some of the condition that they are symptoms and signs of manifestation that they go through. So it's very important that we anticipate and assess the situation. There are many scales and questionnaires to assess for violence risk, but I'm not going to touch on any such things today because our time is so limited. So at least we need to assess two things. One is the current behaviors of the patient, the signs and symptoms as said by the previous presenter. We need to know those, and we need to really anticipate that there is always a chance of a danger that may come forth if you're not taking adequate precautions. Let's go to the B. So A is assess, anticipate, and the third A is awareness, or be aware of the situation at all times. The B stand for, the alpha B stand for body language. And there's another B that I like very much is called the body system. So let's explain both. What is body language? What does that mean? So wherever we stand, or wherever we are located in relation to the patient, we need to exhibit a body language of confidence that really means something in a situation where we are more vulnerable to violence or so. That includes maintaining eye-to-eye contact, looking around, making sure that always the phone is in our pocket, just to remember certain very practical things that we need to do on a daily basis. Don't keep your hands on your phone, or just keep texting someone when you walk into someone's room, because once you keep your eyes away from anyone, it could be a human being or animal or so, that doesn't show that you're confident enough. Even if you're chased by an animal or something like a dog, maybe a pet dog, the best way to stop a dog is to look straight into their eyes. And when we deal with human beings, we need to be better in that. So we need to always have our eyes fixed on a patient to observe what's going on, whether they are moving. So the eye-to-eye contact is very important. That's a part of body language. Never turn our back on our patients. Never have our hands in our pocket. Our hands must be empty at all times. Something that I specify to my students at all times is that I shouldn't see anything in your hands, not a key, not a paper, not a file, because when you are with patients, especially mental health patients, your hand must be free if you can. Sometimes we need to hold something, medication, that and this, and we can always understand that one hand can be free, the other hand can have something that is necessary for patient care, but at least one hand should be free at all times. And have the door open at the back. Your placement should be always closer to the door. Never close yourself in the room with a patient. If in any case, if you're doing a private examination or something, have a buddy with you. If the door is locked, always have a buddy. You need to talk for yourself. You need to be an advocate. We need to be an advocate for ourselves. Have a buddy with you when you have the doors of the patient or the rooms closed. Stethoscope around your neck. Please don't do that. Nowadays, it's getting so dangerous, as my previous presenter said. It's becoming a different situation now. have the stethoscope in your pocket, because the number of nurses who are being pulled in their hair and stethoscope is increasing day by day. It's multiplying. It's not like just going in numbers, it's doubling day by day. They hold both sides of the stethoscope, pull people down, or they pull the hair of nurses. If they have long hairs kind of thing, they pull it down so that nurses will have a fall on the back and have an injury in their hind part of the brain or medulla or somewhere around that, which is life-threatening, Pondane hemorrhage or Pons hemorrhage, which is life-threatening. So always put up the hair about the shoulder level. Let's go to the buddy system now. Have a buddy with you, very important. Every time when it's possible, have a buddy with you. Who is free? Maybe a PCA is free. Okay, tell her to come with you. Just walk in with, just be there, because they're working 12 hours. Someone is working 8 hours. They are there. If they're there, have a buddy with you. But especially if you're going to a room of a violent patient or a patient who is potential for safety hazards or violence or so, or someone who is withdrawing from alcohol, someone who is going through a psychiatric condition, someone who is going through cognitive disorder like dementia or something similar to that, please have a buddy with you. Buddy is always helpful. Even it can prevent you from a criminal assault. As you saw, the first type of violence is a criminal violence, where when you go to the parking lot or so, we need to always find some security personnel to accompany us, or maybe just wait for 5 minutes so that our buddy will join us to the parking lot. So waiting for 5 minutes is always valuable than just walking yourself to the parking lot and getting assaulted up there. Let's go to number C. C stands for communication and maybe collaboration. So what is communication? Communication is the best tool that we have. Who to communicate with everyone possible, especially with a physician. If the patient is going through any such kind of conditions like a withdrawal or a mental condition or abusive language that they use, profanity or anger or confusion, please communicate with the physician, because we have very powerful medical restraints. We call it as chemical restraints or medication restraints. We can sedate people. We can help them with some tablets or medication so that they can settle down if they are escalating. So communicating with physician, communicating with the leaders like managers, assistant managers, to let them know what's happening with you will put you in a better stance. Not 100% protection, not 100% what do you call assault-proof environment, but still you can bring it to up to a 50% protection if you communicate with people. But more than that, communication and collaboration must happen between parallel or collateral professionals or interdisciplinary team members, especially with nurses and other people who are with patients for a longer time, especially with nurses who are coming forth in the next shift, or it continues, it's 24/7 kind of. When a new nurse is coming in the next shift, we must communicate. So recently I've heard an incident that happened in one of the hospitals here, that the nurse failed to communicate that the patient was angry, and patient made some threats. And this nurse was a male nurse, fortunately, like a big man, but he didn't have a concern. He knew that he could manage the patient, but he failed to communicate one thing. In the night shift, one of the nurse was coming, an older nurse was coming in, but one word that he did not communicate was that, okay, this patient is a little aggressive. This patient made some verbal threats against nursing staff, and that little wording didn't cross, or that verbiage did not cross during the shift report kind of thing, and the poor nurse was assaulted the night shift. So it is avoidable kind of thing. So be very sure that we communicate. It's a big topic, communication, collaboration, a big topic, but we need to get to the next one, D. D stand for de-escalation. De-escalate the situation. How do you want to de-escalate? There are different mitigation strategies to de-escalate, like attending crisis prevention training, attending all those kind of classes like this, and making sure that uh, we maintain an open body language, making sure that we maintain a distance, safe distance with the patient, and making sure that when you attempt to directly confront the patient, there's adequate support. Like, for example, you need to have a code within your staff members. Like, for example, call Dr. Armstrong. What does that mean? It's a code. There's no Dr. Armstrong, but we need some arms that are strong right in this room. That's a code. Something like that can bring people in so that there will be a better person to de-escalate that situation. Staying calm, very important. Moving out is more important. So let's go with E strategy. I can talk more about de-escalation, but I need to end in 2 minutes, so I need to go to the E strategy. So we went with A for assessment, awareness, and anticipation, B for body language and body system, C for communication and collaboration, D for de-escalation, and last one is E is exit, escape, and educate ourselves more. So that's a lifelong process. So what is exit? What is escape? What is educate? So exit is locating ourselves to the closest near to the door so that whenever we see the first sign of a verbal or a physical, I say verbal or physical because verbal, between verbal and physical will be 2 seconds or maybe 1 second. So when you see a verbal that I'm going to do this, or I'm so angry, I'm mad with you, who are you? So that kind of a verbal assault or the warning itself is a time for, is a warning for nurses to make their exit plan out of the room or out of the hallway, out of the nurses station. There all need to be always a hiding place which is locked from inside, which should be the medication room with a code, or maybe a bathroom that can be locked from inside. There must be a hiding place everywhere. So exiting the room, exiting the hallway, exiting, that should be one of those strategies we need to keep as first and primary at place. Second one is escaping sometimes. We are not selfish people. We need to help others. We need to help our co-workers. We need to have a strong team based plan to help people, each other kind of thing. That's number one. Keep it as a priority. Sometimes we are very selfless. Like if I see my fellow nurse or student getting injured, I don't exit, I don't escape. I fight, and then probably we'll all escape together. That's my strategy. But there is an escape in that too, or after that too. But escape is very important. Hide, escape, call for help, get into a closed room as soon as possible. Will it prevent 100%? No. Recently, in one of the hospitals, the nurses escaped to a room, but the patient went behind them, and patient and 3 nurses were inside the escape room. All 3 nurses were assaulted, almost to a level that they were in the intensive care for 3 days or so. So sometimes escape plan doesn't work, sometimes it works. Most of the times it works well. And the last one is educate and re-educate ourselves. I do not know how many participants are there today, but whenever we get an opportunity to educate ourselves with the most recent trends, and today I was so happy to hear about the ideological violence that is seen now, because we belong to 2 political parties, or if one is religious and other one is not religious, then there is a violence that's happening right there because your ideologies are different. So we need to educate ourselves into all upcoming trends and demands and strategies and all those kind of things, which will prevent, up to an extent, help in mitigating violence. And I believe I could, or we could actually give you some idea on how to mitigate violence, how to prevent some kind of violence if that's possible. Thank you so much.
All right. Can you guys hear me?
Yes, we can hear you.
Yes.
Okay. Thank you so much, Dr. Bobby Vargas, for bringing all those information, especially we talking about the awareness assessment, which is very true. You know, you need to be aware of your surroundings. We need to know our patient. Sometimes, you know, the patient can be really like very normal in the daytime, but sundown, you know, the night shift is coming, all those problems starting, and big problem like violence and all kind of things. We see that all the time. And also, With that being said, like the body language, communication, everything is so important. One point I just wanted to add, and we, Dr. Bobby Varghese and also Dr. Sarafin mentioned that, like we as a nurses, like we get a detailed report about our patients, but not that, our PCAs or maybe the CNAs, radiology tech coming to the room, dietitian coming to the room, a lot of people visiting that patient, they may not know the full detail of the patient. So what happened with patient is sleeping calm and quiet, they go into the patient room thinking that it is a normal patient, so they don't know the full report of the patient. So it is our responsibility to give us or warn them that, hey, there is a violent patient in that room, may not be acting up now, but we don't know. So this is my request to each and every nurse here, like give them at least little awareness about your patient, little bit of report on your patient, like, hey, the patient can be a violent patient. So protect them too, as this is our responsibility too. So thank you so much. Now it is time for open forum for asking questions. So you are free to ask any questions to Dr. Serafin, Dr. Vardham, Dr. Bobby Varghese. Go ahead. Let's see if anything in the chat. Anybody, any questions?
Um, any other strategies that you would like to, because you're working directly with patients and maybe based on your personal experience, there might be a better strategy that you have personally implemented or personally seen that was a little bit more than what we said. Please try to share with. We are a bit early, like we have 12 minutes more to complete. It was from 11 to 12. We are a bit early kind of thing because we need to give you time, 15 minutes for this one. You're not early though, but we are at the right time. So so anybody has any personal stories to share or anything like which might be may not be a better strategy, but maybe one of the strategies, please share with us. You may unmute yourself.
Dr. Bobby, I'm not sure. I joined in late. There were issues with the network. So I do not know if this strategy is being used. I myself was once, I want to share this with everyone. I myself was um, a victim of violence. I had a patient with me and the other colleagues running around with an IV pole. And what had happened was, I had floated to that place, like in one of the sister facilities, and I did not have access to all the doors, you know to enter into the system. So a patient came running violent behind us at the nurse's station, and everybody flew away and took their places under the tables. They went into the other rooms and locked themselves. But then what had happened was I did not have access to get inside one of these closed doors that was like the storage places. And then what happened was that he was coming behind me. So what I did was, then somebody else saw me through those windows that were open. There is a small cracked glass opening. They saw me that I was out and they pulled me inside. If not, I would have been beat up on that day, running around behind me. So what I also have seen now, they have made changes that they have given access, universal access to doors. Whoever is floating over there, that they can have access to the doors everywhere inside. I think if we have access like that, universal could help us too, whoever is floating to other places, or the doors to all this access where other patient cannot enter into those rooms.
Thank you, Dr. Fernandez. That was,
Yes,
yeah, thank you for sharing. I hope you finished, right? Did I cut
yes,
you?
yes, yes.
No,
Thank you.
no, no. Okay, great. So that's a very important strategies to have an access to doors, because float healthcare workers, which include float nurses, float PCAs, they are at the highest risk among healthcare workers to get attacked because they do not know the exit plans or escape routes. So very important strategy. Sometimes I tell my students and the fellow nurses who work with me that God has given us two hands to protect ourselves. So make use of that two little hands. And how do you want to make use? Make use in any ways that a normal, reasonable person does to protect yourself. At the end of the day, we need to be back home in a better condition. There are people waiting for us back home. We have dreams. We have ambitions in life. We need to be alive. So use your hands to protect yourself. Like in cases, if you want to push a person, feel free to do that. In case if you need to punch someone, just be bold enough to make that punch, because you did not initiate that punch. Somebody else did that. So you need to protect yourself. So if you want to punch them back and escape, that must be done, because we, especially as nurses and healthcare workers from a different origin, because our culture is somewhat different, to be submissive, to be humble, and that and this. Sometimes that strategy may not work. If you need to fight, we need to fight. If you need to grab a chair and uh, protect ourselves. I'm not trying to say that you need to beat someone to death, but at least do whatever you want to protect yourself. Do it and escape. It's very important that we do that, because many a times, at least in my 20 years in the US and many more years outside of the US, I've heard people saying that, okay, some of the nurses from some cultural ethnic, they can fight, but I can't. That's an untrue kind of a notion. Everybody can fight for their life. The only thing that will prevent us from fighting and escaping might be maybe a patient who might be twice the size of you, or maybe when you're in a closed room or kind of thing. Otherwise, you can fight for your life if you can, and just run for life, which is the second thing that you need to do is without like, if you can't fight, you need to flee. So thank you, Dr. Fernandez. And don't worry about the consequence of fight. The consequence of fight can be dealt later, but you're alive to face the consequence. What if you're not alive? What if I'm not alive? So that must be our thought. We must be alive to face whatever is coming forth later, but we need to be alive. That's very important. Thank you. And I believe Dr. Serafin has something more to say on that.
Oh no, I totally agree with you. Yeah, definitely. When you do find yourself in a situation where you're being attacked, definitely flee, flee for your life, because it's not worth it. Because it just has a very devastating effect on the nurse, their family members, the staff. Yeah, because it's just a very dangerous time now. So definitely, like Dr. Bobby says, just pay attention to those signs, and definitely defend yourself by fleeing the situation. Mhm.
Um, I just wanted to add one point to that, like Dr. Nancy Fernandez was talking about.
Mhm.
What we used to do is like we have a printout, we give to the float nurses or the PCAs, anybody coming to our floor, and we give a little bit of orientation about that floor. I was always doing that. Any float person coming to our floor, we hand over that paper with all printout with all the room codes and every single thing. And I will give them a little tour about the, like the unit. Another thing is like, for example, if you see a sitter, it can be a PCA sitting, it can be a real sitter sitting or a nurse sitting. If you see them like sitting in the corner of the inside the room, you need to tell them, hey, you need to sit at the door side, because this is one thing they always do. They are finding a comfortable place all the way inside the room to the corner. So if anything happened, they're like trapped already. They have no access to go out or run out. So I always tell them sit at the door side, so they have easy access and they can run, for their life. Yeah, that's what I notice. Any other question? Anybody? You are free to ask. We still have few minutes.
There is a question on the group chat. Maybe Dr. Serafin can try answering this. Is there any recommendation as it pertains to home care? Great presentation, very thought-provoking.
In terms of home care with violence, I just
Yeah,
wanted to
the ones that probably it's about people doing home care that you're in a
oh yeah,
stranger's home. Yeah, you're in a stranger's home, and if you encounter what are strategies that you need to like.
definitely if you're a healthcare provider and you're providing care in a patient's home, hopefully I'm answering your question correctly, especially if you're working with somebody with dementia or significant delirium. Yes, it could be a compromising situation. So my high recommendation is, when you do go to patient's home, it's important that you know where the exit route is. Because if something happened, definitely you want to know where to escape. Because when you're in someone's home, you're in their environment, and it could be a little intimidating. Again, you got to know the exit route, and you have to use your intuition too. If you feel like you may get hurt, I definitely recommend call the home health agency and tell them you're not safe. Because I had other colleagues, who went into patients' home. And for example, I know this nurse, he told me that every time he provided care, there was a gun on top of the counter. And, he's a guy, he was, a little brave. And he said, I just went ahead and provided care. But if you feel like, you run into that situation, I don't recommend that you provide care there. You definitely need to reach out to the home care agency and tell them it's not safe because it's your life. And if I've heard horror stories where nurses, other healthcare providers went into the patient's home, either they got raped or they got killed or severely injured. So you definitely have to use your intuition. And if it's not safe, don't go in there. And if you do go in there, for some time it could be unpredictable. If you do go in there, just assess your environment. Make sure you know where the exit route is. Make sure you have your cell phone on you to call 911. Yeah,
Thank you, Dr. Sarafi.
no problem.
And can I say some strategies that I used in the home healthcare?
Okay,
Uh,
go ahead.
yeah, in some of the, if you keep your, if you're taking your iPad and you're going into that homes, you want to keep the Bluetooth available so that your agency also can track you where you are at that time.
Yeah.
So if you want to do your documentation, everything, and you are in that room, they can have an access to where you are exactly. Also, keep your volume on the laptop so that they can hear you if there is any violence, because you have to know that somebody else is also monitoring you if you work for high-end companies, like when I work for two, I do that. And some agencies are also providing videos now that go on the front which monitor you, so make sure that you're using those monitors are on all the time, and they're charged so that the other agency is watching you. It's for your safety. It
Yeah.
is not only to monitor what you're doing, but also one end is for safety.
Yeah.
Thank
Very,
you.
very true. Thank you, Dr. Fernandez, for bringing that information to our group. Very valuable information. Any other question from anybody? If not, I think we're on time. All right, I don't see any.
Can I remind everyone something really quick?
Yes, sure.
Yeah. Our facility provide self-defense classes for all healthcare professionals.
Okay.
If you guys are working in Memorial Healthcare System, those classes are very helpful in certain situations if you do not have help immediately. Even your clinical equipment like a pen, scissors, you can use it in that situation to defend yourself. So I would like to encourage everyone to attend that class if you are working in Memorial Healthcare System.
Good. Very good. Thank you. Thank you so much. Very helpful. All right. So with that being said, I think that's it. I believe nobody else has any question here. All right, Doctor, thank you so much, Dr. Varda Serafin, for bringing us all those valuable information and your busy schedule. I really appreciate that you're with us now. You know, like you got a lot of information. Thank you so much. Dr. Bobby Varghese, at the same time, you know, like you, very valuable information. And I'm sure we have a lot of takeaway from this session. And to a certain extent, you know, of course, a lot of things are preventable, but sometimes we have no time to even defend. You know, the attack is so fast that we can't even think about it. So thank you so much, everybody. And I like to thank our INS Health Executive Team and Governing Board for making this happen. And I'm very sure that this session was very helpful, a lot of information for everyone. I would also like to extend our sincere thanks to NANA dignitaries and our mother organization for joining us today. Not but least, you know, I really wanted to thank each and everyone joined here for this session. Thank you so much. I really appreciate everybody's presence. That means, you know, your presence is a lot to us. And thank you so much. And together we can do a lot. Thank you, everyone. Thank you, Dr. Varda and Dr. Bobby Varghese again. Thank you.